Hi all, my name is Cambell Anderson and I'm doing this presentation for Kelly Chang's psychology class alongside my partners Jaxson Turituri, Gage Moxley, Lenny and Jacob Parmer. Today, the five of us are going to be talking about community psychology. We'll discuss prevention, community intervention, and critical elements of the community psychology approach, such as social justice, the ecological model, and research methods. We'll also talk about how community psychology relates to the coronavirus pandemic.
So first we have to answer, what is community psychology? Well, the Noble module defined it as the branch of psychology that seeks to understand complex individual to environment interactions in order to bring about social change. Community psychology really got to start in the 1960s. This was a time when there was growing dissatisfaction with psychology's heavy focus on individualism. Big societal events like the Civil Rights Movement and the Vietnam War made psychologists realize that many problems weren't just individual, but actually systemic. And so, with this in mind, they wanted to prevent the problems before they even started, not just treat them once things went wrong. Community psychologists emphasize collaboration, political reform, diversity, and empowerment. They often work directly in communities rather than just staying within clinics or hospitals. So in many ways, this branch of psychology is much more grassroots than like traditional approaches. It focuses on like systemic change from the ground up. And so now that we understand what community psychology is, let's take a closer look at one of its biggest priorities, prevention. So there's two different ways to think about change. So there's first order change, second order change. Pretty simple. First order change focuses on fixing individual problems without really addressing the larger systemic issues behind them, big picture stuff. So, how does this look in real life? Well, let's start small, like preventing the spread of the flu out of school. So, for example, for a school nurse treating a child who just caught the flu, that'd be first order change. It helps that specific child, but it only helps that specific child. It doesn't stop the flu from spreading across the school. Second order change, on the other hand, had to fix the broader conditions that caused the problems in the first place. So instead of just in our example, just treating each kid individually, the school could install hand sanitizer dispensers every classroom throughout the school. And this would systematically lower the chances of anyone getting sick, preventing the problem before it grows. And that would prevent the need to treat as many individuals to begin with. A real world example of a second order change comes from the 1960s when smoking was very prevalent. In fact, about 42% of Americans smoked. But once research revealed how harmful smoking was, advocacy groups focused not just on treating smokers, but actually on changing laws and public attitudes and perceptions on smoking. So there was efforts like banning smoking in public places, raising the legal age to buy cigarettes. All of this helped to bring smoking down. And it went all the way down to 14% in 2019, according to the CDC. So for community psychologists, they believe that these kinds of broad preventative measures are far more effective than just trying to fix individuals after the damage has already been done.
Community psychology takes a social justice orientation, which means that it recognizes the need for us to participate in research and action for the betterment of society. A social justice orientation considers how to provide equal opportunities in many different aspects of life, such as education, work, housing, and healthcare. It recognizes that individual psychology is affected by community problems that are caused by social inequalities. These injustices can help lead to or even cause crime, mental illness, homelessness, poverty, and issues with employment. For example, according to a study conducted by Marjorie Austin Turner and Ruth Gorovich, people in historically segregated neighborhoods experience the most poverty, which causes stress that then leads to excessive physical and mental health issues. To get a better grip on this concept, let's examine incarceration using the social justice orientation as a lens. Imprisonment reflects social and economic inequalities. According to Northeastern University, the cradle-to-prison pipeline is a term used to describe the disadvantage that some individuals find themselves facing due to a variety of systematic issues. For example, young people of color are pushed towards adulthood incarceration. Black girls are nearly 3 times more likely than white girls to be referred to juvenile justice. Also, Black Americans and Latinos are 5 and 1.3 times more likely to be incarcerated than Caucasian people, respectively. Clearly, people of color are disproportionately imprisoned. This is not their fault. It is a product of their environments and a faulty justice system. Additionally, police disproportionately assign high fines for low-level offenses to low-income people of color, according to a 2015 Department of Justice report referenced in the same report by Northeastern University.
So we have the ecological perspective, which has 4 main levels of analysis: personal, social, community, and societal. And the image or figure shows kind of what layers there are within that level. So at the core center, we have the individual, then we have community, and then social. And community psychologists can utilize this for gauging different things such as human behavior, thoughts, and feelings. And they try to use this to gauge how societies, communities, individuals are intertwined. So we have the principles of the ecological model. Community psychologist James Kelly has proposed several useful insights or principles that help us better understand the social environments and how they affect people. First, we have the ecological principle of interdependence, a mutual dependence between things, and indicates that everything is connected. We have the ecological principle of adaptation, indicates that behavior adaptive in one setting may not be adaptive in another setting, such as if you have a behavior that you picked up in, say, New York City, and how you have to live there, then you come here to Newburgh, Oregon, maybe certain behaviors are not really quote unquote needed. Like, then we have a proposed ecological model of stewardship. The model follows the framework of Vaughan and Brenner's 4 elements in which an individual may land in. These 4 environments are recreation, neighborhood, home, or occupational or workplace. Home, always like where you live. Neighborhood is an element of the human-built environment. This includes local and civic organizations. Think like your local park, coffee store, that kind of thing. Recreation, facilities and social groups for recreation, exercise, and physical activities. Then occupation, where you work, kids go to school, that kind of thing. Community psychology as a science. Research-based approach, not based on opinion, but scientific data. Methodologies or use quantitative methods, mixed methods research, action-oriented research, and community-based participationary research. Quantitative research are descriptive phenomena expressed in words. So they focus on non-numerical sources of data. These can include language from case studies and analysis of personal narratives. Qualitative research is helpful in understanding people's lived experiences in their own voices. Qualitative methods, by contrast, are those describe cold, hard facts using numbers. When researchers combine these methods into a single study, it's known as a mixed research study. It's the most common use is helping understand complex social issues. We have action-oriented research, which involves a wide variety of evaluative methods that link together taking action and doing research at the same time. So the findings of that research are being implemented immediately. And those who use this approach often critically reflect on their actions and their methodology in this research in order to examine themselves and the research impact on the population of interest, making corrections as needed to achieve the best with ethical outcomes. One such research is called community-based participationary research, which is described as actively involves community members in shaping of the research or service agenda. Then community-based participationary research is where the community itself is involved in participating in the research and implementing the changes based on that research, such as using the findings and that kind of thing.
In community psychology, we use several different types of research methods. Qualitative methods focus on capturing the voices, experiences, and personal stories of individuals and communities. Quantitative methods use data and statistics to spot trends and compare different groups. Mixed methods research combines both approaches, giving us a deeper and more complete understanding of social issues. A key approach is community-based participatory research, or CBPR, where community members are actively involved in shaping the research goals and methods. This ensures that the findings are relevant, inclusive, and more likely to create real-world change. An example of action-oriented research from the chapter comes from Burman in 2017, based in Southern Africa. A group called the Artist Proof Studio partnered with researchers to create a photo-based intervention program. They used photography to raise awareness about HIV and AIDS, which affected about 17% of the local population. The goal wasn't to just study the community, but also to make a real-world impact while conducting research. This project shows how community psychology often blends research with direct action to support and empower communities.
So now we're going to look at the connections of community psychology and its intersection with the COVID-19 pandemic. As the COVID-19 pandemic did have such a wide affecting breadth in the world, it is inevitable that psych community psychology would be involved to address some of the effects that are caused by the pandemic. So, as mentioned just a second ago, the COVID-19 pandemic affected a wide range of populations on a large community scale level. Um, to the sources at the bottom of this slide, Howard 2024, a news reporter from 2000 from CNN, and the World Health Organization in 2022 said that self-reports of well-being and anxiety and depression saw a massive, uh, substantial effect. You know, well-being going down, anxiety and depression going up. and affecting people, communities on a large scale. This, of course, affected those it disproportionately affected those people that were affected by inequalities, right? So community psychology is also doubly interested in the COVID-19 pandemic as it affects it affects minorities and other people that have are suffer from inequalities. Um, Not only this, trust in institutional bodies was also affected. So likely those institutional bodies that are trying to help curb the pandemic with information and initiatives, if you don't trust them, if the regular public is not going to trust them, then there's not going to be any way to be influenced or persuaded to um, take up their strategies and their techniques for combating the COVID-19 pandemic. So that was also something that was affected as well. Um, it was also found, interestingly enough, as far as community psychology goes, that communication technology was a way to not only reduce social isolation that was affecting decreased levels of well-being and increased levels of anxiety and depression. It also increased the trust in these institutional bodies. So community psychology was influential in, or rather, took upon itself to increase the usage of communication technologies to increase academic attendance, social connection, um, and things like delivery of foods to keep people outside, to keep people inside, and still be able to get groceries and stuff. So it's things like Uber Eats and other types of pickup initiatives that stores, restaurants, and many other food industries um, establishments are now providing for communities. So the utilization of that and spreading that, disseminating that information to people through communication technologies was was something to be used to affect a lot of people in combating the COVID-19 pandemic, so that it didn't spread to other people and kill a bunch of people. That was what they were saying. But also at the same time for mental health. Specifically, telehealth was also made more available to people because of the pandemic. You couldn't just easily go into your regular scheduled meeting with your psychiatrist, therapist, or psychologist. So telehealth options were provided, were encouraged, so that the wider community could be supported with mental health professionals. And it wasn't just that, oh, we were going to give mental health professionals more studies and more techniques to allow people to these professionals to be able to address some of the depression or the anxiety or many of the other mental health issues that individuals were having. What they did, what community psychologists really, community activists also really did, was saying, like, instead of just helping them affect just a few people, why not give them communication technology so they can get to more people more easily? So therefore, affecting things on second order change, as Jaxson was talking about, like things that are things that affect a larger swath of people and affect and address problems on a larger scale and not just individuals. And now what we see is actually telehealth has continued. You see, it's more common to see telehealth options still available now. Now that the COVID pandemic is not really considered to be very much of a threat anymore. Now telehealth options are still being offered and utilized for easier access to a mental health professional. Um, it cuts through all of the paperwork and the waiting in waiting rooms and all of those stagnant barriers that made mental health services a little bit more difficult to get to. So in that way, it actually has created an interesting situation where now people can get more mental health more easily and it's more available. So in that way, community activism has uh, had a I guess maybe some people might say positive effect on from the community at large. So that's kind of that's just one short example about the connection between community psychology and the COVID-19 pandemic. There's many more, but this is just one particular example and precedence.
To sum up, community psychology focuses on stopping problems before they start by addressing issues early on. It is also about fairness for everyone, making sure that people who often get overlooked still get the help that they need. It looks at people and their surroundings, like families, schools, neighborhoods, and even larger systems like laws. Community psychologists work together with communities, partnering instead of just giving orders. And finally, while it's deeply committed to justice and fairness, it's always backed by solid research and real evidence. It's not just about good intentions. I'll leave you with this quote from Coretta Scott King. The greatness of a community is most accurately measured by the compassionate actions of its members. Community psychology reminds us that lasting change starts with small, meaningful acts. So ask yourself, where can I create positive change? Who in my community needs help? Whose voice needs to be heard? Each of us has the power to make a difference, and it just starts with us taking that first step.
Thank you so much for watching our presentation. Please let us know if you have any questions. We'll be happy to answer them.